Good day, I am Aldrin Havaliano and this is CHN Skill Preparation and Administration of Oral Rehydration Solution or ORESOL. So by definition, an oral rehydration solution or ORESOL is a solution taken by mouth to replace fluids and some electrolytes lost during diarrhea or other conditions that cause rapid fluid loss. Now, there are six purposes of this procedure. Number one is to replace the lost fluids during diarrhea or other illnesses that cause rapid fluid loss through the oral routes. Number two is to introduce salt back into the body to prevent further damage from dehydration. Then, number three, to introduce sugar into the body to improve the intestinal absorption of salt. Number four is to reduce the need for unscheduled intravenous therapy. And fifth, to reduce stool volume. And sixth is to reduce vomiting. This procedure is indicated for the treatment of dehydration in patients, both children and adults. And it is contraindicated for patients with glucose tolerance disorder, acute renal impairment, ileus, paralysis, and perforation of intestines. And it has a special consideration for for signs of severe dehydration, transport and refer the patient to the hospital immediately to rehydrate through IV routes. So the following are some equipment that you will need for this um, procedure. One sachet of ORESOL, a teaspoon of rock salt, 8 teaspoons of sugar, a liter of sterilized or distilled water or the cleanest water available, a stirring rod or a ladle, a clean container, a knife or a flat object if applicable, and a clean calibrated glass. So before proceeding to the preparation, first assess the extent of the client's dehydration because the amount of the oral rehydration solution needed for patients with mild, moderate, and severe dehydration differs. The next is weigh the client because again, the amount of aerosol depends on how much they weigh. Now, after this, in preparation for the procedure, wash your hands to prevent or avoid transmission of microorganisms. So, to prepare the aerosol solution, first, using the pre-packed aerosol, dissolve 1 sachet of pre-packed aerosol in 1 liter or 5 glasses of sterilized or distilled water in a clean container. So, you may use the cleanest water available. So, using of safe water ensures that it will not be contaminated when taken by the patient. So, to prepare the aerosol solution, first, using the pre-packed aerosol, what you're gonna do is open it up and dissolve 1 sachet of the pre-packed aerosol in 1 liter or 5 glasses of sterilized or distilled water in a clean container. So you may use the cleanest water available because it is important to use um, clean water because the using of safe water ensures that it will not be contaminated when taken by the patient. Then, with a knife, let us stir thoroughly. Now, stirring thoroughly makes sure that the contents are mixed well with the water. Now, for the preparation of ORESOL by producing a homemade oral rehydration solution, first pour a liter of sterilized or distilled water to the clean container because again, using of safe water ensures that it will not be contaminated when taken by the patient. And the next, take a teaspoon of rock salt leveled by a knife or a flat object for accuracy of measurement. It is important that salt is the salt we're going to use is in an appropriate measurement, because salt is used to replenish the lost electrolytes and nutrients. So too much of salt can harm the body. In this case, I have already measured the amount of salt to be used. So add the salt into the water. Then take 8 teaspoons of sugar leveled by knife or any flat objects for, again, accuracy of measurement, because sugar is used to replenish the lost electrolytes and nutrients, and too much of sugar can make the diarrhea worse. So like the salt, I have also measured this one out. So I'm going to directly add the sugar into the water. And then stir the mixture. Now, after mixing it thoroughly, take the mixture and taste it. If it is saltier than your tears, then discard the solution and prepare another mixture using the same process and the exact measurement, because too much salt can cause more harm to the body than good. Then after you do it, stir thoroughly the solution again to ensure that the contents are mixed thoroughly. Then you can also make a mixture of 1 glass, which is 240 ml, by adding 1 pinch of salt and 2 teaspoons of sugar only. So these measurements are only intended for a single use. Now next, administer or teach the mother to give this solution to the patient. Now the amount of ORESOL needed for patients also depends on how much they weigh. It is important to educate the mother or the support person for optimum efficacy of the solution. So for mild dehydration, give 50 ml of ORESOL per kilogram of body weight in 4 to 6 hours. And for moderate dehydration, give 75 ml of ORESOL per kilogram of body weight in 4 to 6 hours. Now, for severe dehydration, give 100 ml of ORESOL per kilogram of body weight in 4 to 6 hours, except for coma. This is because the amount of solution increases as the dehydration of the patient becomes more severe, so that it can work to replenish the fluid and electrolytes that have been lost. Now, after all of these, assess the patient's hydration status every 4 hours. This is to evaluate if the oral rehydration solution is working well for the patient and to address any abnormal progress of the patient's condition. Now, once you are done with the preparation and administration of the ORESOL, what you're going to do next is assess the patient's hydration status every 4 hours. This is to evaluate if the ORESOL is working well for the patient and to address any abnormal progress of the patient's condition. And if the patient needs to go to the hospital, give him or her oral fluids on the way if he is conscious. This is to ensure the patient is still being rehydrated and for the continuity of care. And lastly, use the prepared solution within 24 hours only, and discard the remaining solution after 24 hours, because the solution is no longer an effective remedy for dehydration after 24 hours.